Introduction. My own journey to better health began with challenges, as it may for many of you. The pursuit of better health has been a very rewarding journey for myself and my family. It became a meaningful career and a life's work. All my experience and knowledge have led me to a mission of sharing what I've learned along the way to help people like you learn how to achieve the power of feeling your best. I hope you are excited to take your own journey to feel your best. Growing up in Michigan, I loved my childhood. My parents were great. But like many baby boomers, I did not get a lot of guidance or supervision. Just come home when the streetlights come on. I was raised on a diet of Captain Crunch cereal, whole milk, white bread, bologna and Miracle Whip sandwiches, beefaroni, and Hostess pies and cupcakes. Kool-Aid and Pepsi were my drinks of choice. I had skin and digestive problems from age 8 to age 20. Was prescribed cortisone cream along with oral medications for over 10 years, and was told by my doctors that my problems were due to sensitive skin. In 1978, I stopped drinking cow's milk on advice from my economics professor, Dr. Louis Junker. Dr. Junker had a shaved head, rode his bike to work, dug his own well, was fit-looking, and was extremely passionate about his health and well-being. It was Dr. Junker who first opened my eyes to the power of food, that food is truly medicine. Dr. Junker was a gift to Western Michigan University and its students, and I will forever be grateful for his guidance and inspiration. My first job after graduating from college with a business and economics degree was with Butternut Bread. I was hired as a route salesperson, delivering white bread along with Dolly Madison cakes. I would wake up at 2:30 a.m. and work until 6 p.m., putting in 75 to 80 hours per week and running the entire day. I was sleep deprived. As I look back on it, my adrenal glands must have been shot. After 1 year with Butternut Bread, I went to work for Frito-Lay on the recommendation from one of my lifelong friends, Rick Norris. Again, as a route salesperson, delivering Doritos, Ruffles, Lay's, Fritos, Tostitos, and Cheetos. Frito-Lay was a great job with reasonable hours, and I stayed for over 6 years. For over 7 years, I lived in the grocery stores watching and learning how the stores get you to buy, but most of all, watching and observing the people and what they were putting in their grocery carts. 2 years into working with Frito-Lay, I knew I wanted to pursue a different path. But what? I looked into physical therapy and sports medicine. I loved working out and got interested in bodybuilding and eating healthier. What really changed my life was a 2-hour talk with Dr. Kwok Ho, an exercise physiology professor at Michigan State University. Dr. Ho asked all the right questions. As I stood up and started to leave his office that day, he said something I will never forget. "Chris, you are a prevention guy. So go out in the world and help people get healthier and stay healthy." So in the fall of 1985, I entered graduate school at Michigan State University, and Dr. Ho became my academic advisor. After going to graduate school and acquiring a master's degree in exercise physiology, I went to work for Butterworth Metropolitan Wellness Center in Grand Rapids, Michigan. On a typical day, I would spend the first 4 to 5 hours of my day in the hospital doing executive physicals. Each physical exam began with an intake interview to evaluate the patient's current lifestyle. Did they sleep well? What did their nutrition look like? Were they moving their body on a regular basis? Was stress an issue in their life? Were they on any medications? What were their past and present injuries? Most of all, what did they want their future to look like from a health perspective? After the interview was completed, we moved on to a variety of assessments. These included a stress test on a treadmill, a spirometer test to measure lung function, a flexibility and balance assessment, blood work, and a one-on-one session with the doctor. I learned a great deal about heart rhythms, lung function, and medications, along with listening to how the doctor talked with the patient. What I really enjoyed most about this experience was trying to inspire these people to take the next step to feel and be their best. The second half of my day was spent speaking with organizations and their people about health and wellness, including how they can improve their blood pressure, type 2 diabetes, cholesterol, weight control, and improve their health. This was my first experience speaking in front of people. In the beginning, I was extremely nervous. I was raw and most likely not very good at it. But over time, I truly enjoyed having fun with the audience and helping people see the light of what was possible. A few years later, I went to work for a family practice physician, Dr. Barry Saltman. Dr. Saltman was a wonderful man and extremely hardworking. He saw on average up to 40 patients a day. Yes, 40 patients per day. Dr. Saltman wanted to build a small 5,000 square foot exercise facility in the basement of his practice and asked me to help him design, select exercise equipment, and develop nutrition and exercise programs for many of his high-risk patients. This was a wonderful opportunity for me to work with a seasoned physician like Dr. Saltman, but quickly I realized I was over my head. There were not just a few high-risk patients, but hundreds, and most needed one-on-one attention. I had never seen so many unhealthy, highly medicated people in my life. I kept thinking, how did all these folks become so unhealthy? Is daily interaction with heavily medicated, high-risk people normal for many doctors in the United States? Working closely with Dr. Saltman, I was given this incredible opportunity to work directly with people who had high blood pressure, COPD, type 2 diabetes, severe obesity, and even one man who had a heart replacement. I loved helping this guy get his health and his life back. Dr. Saltman was an incredible doctor, but even a better person. And I learned so much from his teaching and his mentorship. After 2 years of intense training with Dr. Saltman, I was hired as the Director of Health and Fitness by Carl Porter, the founder and CEO of the Michigan Athletic Club in East Lansing, Michigan. The Michigan Athletic Club at the time was the largest hospital-owned, multi-purpose health club in the world, spanning over 275,000 square feet. My role was to recruit, hire, train, and retain the best and brightest personal trainers, and to develop health and fitness programs for the members. As time went on, we realized many of our personal trainers were not skilled or trained in dealing with the challenging needs of many of our high-risk, highly medicated clients. What we needed was a systematic training program to help teach our personal trainers how to interact with our members and their growing needs. Step by step, we looked at body alignment, injuries, nutrition, stress, sleep, breathing, health history, weight loss, medications, motivations, and how to change behaviors. We developed a personal training program that was centered not just on exercise, but the entire person. Members were seeing wonderful results. Doctors and health professionals started referring more and more of their patients to our program. The word began to spread, and with a few short years, we were one of the highest revenue-producing personal training programs in the United States. For over 17 years, I had the privilege to work side by side and learn from some of the best trainers in the world. I've also done a fair amount of one-on-one training myself, racking up over 20,000 hours. After watching members struggle with information regarding stress, breathing, sleeping, nutrition, weight loss, cholesterol, blood pressure, medications, fitness, and health, I wanted to help more people, so I began doing live seminars. My first book was titled Meal Patterning, based on the eating patterns of the sumo wrestlers. In 2006, I went to Colorado to meet with a branding specialist by the name of Dick Brusso. After 2 days of brainstorming, we came up with the name On Target Living, based on my food target. Attendance slowly grew. I wrote a few more books, demand increased, and after many, many years of working on my gigs, I decided to take my passion full-time. Today, I travel around the world speaking to corporations, organizations, associations, and schools. My mission, our mission at On Target Living, is to help improve the health and performance of people from all over the world, one person at a time. Most people want to have great health. They want to have more energy, a better night of sleep, look good, and feel great. They want to be more energetic and happier, but many are not as healthy and robust as they could be. What would happen if you knew with 100% certainty that something was going to work? No second guessing, no going back, but a true belief that this was your time to shine. When it comes to our health, one of the biggest variables to success is hope. When people begin to truly believe, success soon follows. It is the belief that they can do it. Here's what to expect over the next 34 chapters. You have in your hand a resource guide to help you navigate almost everything you need to know to take care of your greatest asset, and that asset is your health. What makes this audiobook unique is the balanced approach to building your foundational pillars of health: how you rest, how you eat, and how you move. I wanted to write a book that gives you the necessary information to help guide and motivate you to develop a lifestyle that you can learn to love and, most importantly, sustain. I'm excited for you to take this journey with me, and there is nothing more valuable than our health. I've done the work, I've been in the trenches, I've made the mistakes, and now it's time to share this information with you. Your journey to becoming your best self is about to begin, so buckle up and enjoy the ride. Here's to a lifetime of health and happiness.